Opioids have claimed the lives of hundreds of thousands of Americans. And while tighter restrictions are in place, overdoses still happen. Scripps reporter Matt Pearl talks to an organization that wants to get a life-saving drug into the hands of anyone that could be at risk.
I do talk to people who are circling the drain sometimes, and they are often not very aware of how close to the middle of the drain they are.
There's a park 5 minutes from the home of Paul Weishaupt that reminds him of when he was circling the drain, when addiction put him in prison, when a mugshot showed a snapshot of a disease whose grip affects millions.
I can still refer to that person who lives in complete and utter fear for everything. I look at that picture on a weekly basis. I don't forget that. I don't want to forget that.
Weishaupt said he started using painkillers in high school after a soccer injury made them available.
By the time I graduated high school, I was doing painkillers every day, starting to build a physical addiction.
And where did that take you?
Everywhere. I was spending, $400, $500 a day to try to buy pills, stealing everything that wasn't locked down to try to keep it going. Last time I checked, I have 76 interactions with Omaha police.
At that park in 2016, Weishaupt stabbed a man during a drug deal gone wrong. He turned himself in and went to jail, where he says he found the clarity to confront his addiction.
Sometimes when he talks about him, I'm kind of like, did that really happen?
Today, he can sit with his parents and discuss it from a distance. And he says the only reason he's alive is because he had his life saved 7 times with naloxone.
We had naloxone vials from Colorado and California that we would just distribute to our friend group to try to keep each other alive.
Early numbers from the CDC say in 2021, more than 100,000 Americans died of a drug overdose. That's 5 times higher than at the turn of the century. The federal government and every state has taken aim at the problem, and not just eliminating addiction.
We've got to start to evolve the principles in which we approach this epidemic, because we're not going to stop it.
Harm reduction stems from the idea that while a person is alive, they can be reached. Many programs offer free needle exchanges. Others offer fentanyl testing strips, and most provide what saved Weishaupt's life: expanded access to the drug naloxone and its more familiar brand name, Narcan.
We really want to make sure that people who need it have access to it.
Amy Holman works for the Nebraska Pharmacists Association. Pharmacies now have a standing order to distribute naloxone without a prescription.
There are more pharmacies that are realizing that they do need it in their communities. A lot of them maybe didn't think at first that they do, but now unfortunately they are seeing the need to be in the program also. At the end of the day, we don't want people to die.
It's hard to say what and where things are working, but overall, maybe it is. Since early 2022, drug overdose deaths nationwide and in many states have consistently dropped.
I just thought this is how life is.
Just as he doesn't shy from his past, Weishaupt embraces a future where he helps others break free, or helps keep them alive until they do.
What makes you so passionate about this?
I've lost 75 friends in 3 years. So, I'm tired of people dying for no reason.
He's starting a nonprofit to bring harm reduction training to places that need it. He's also a father of a 2-year-old son, Ishmael, and he's a survivor.
I'm able to go back there now and sit with it.
For whom a nearby park is now a place of hope and a reminder of the need to fight.
I just want this world to be a little safer for my son before I go, so that's why I'm doing this.
In Omaha, Nebraska, I'm Matt Pearl.